Question 1. Do you use empathy with clients? Well, okay, that's an interesting question. I guess there's two main uses of the word empathy. One is in everyday speech, so people talk about, being empathic with a friend or something. The other is in the professional realm of psychotherapy, where empathy is described more as a kind of a technical skill. So people think that empathy is like an emotion, whereas from a psychotherapeutic point of view, empathy is the ability to name what someone else might be feeling and to reflect that back to them. So it doesn't mean that I'm feeling empathic to them. That's the description of empathy as a kind of a feeling. It's more about I'm recognizing something important about their experience, particularly on an emotional level. So many psychotherapies, of course, recognize people's feelings and attend to those feelings. Some therapies do that less. So, for instance, cognitive behavior therapy is more interested in how people think. So, and some therapies, such as some of, let's say, the psychoanalytic therapies, particularly intersubjectivity, which is a modern form of psychoanalytic therapy, is very interested in how people think and feel and uses empathy to step into their world. So that's the emphasis really in that mode, is stepping into someone else's world, understanding their world. So most therapies do that in some form or another. In Gestalt, we're very interested in stepping into someone else's world. I really want to know, what does it feel like to be in your shoes? What do you think? What's the impact of your history on you? What is it like, the people in your life, and what is it like to have them in your life? And what is it like to have me here asking you questions or conducting this therapy? So I want to step into their world, and I'm certainly interested in the world of their feelings as well. So in that sense, being empathic is a part of therapy, and you could say it's a part of Gestalt therapy. I think one of the important differences in Gestalt is that it's not just about understanding the client and their experience, and not just about exploring their feelings, although all those elements are important. Gestalt's also about meeting, contact, and I'm interested in how the person comes into contact and how I experience them in contact. So in order to do that, I engage them in dialogue, what we call dialogue, which is more than just conversation. It's meeting at a deeper level. And yes, that often involves feelings. However, that's not just me understanding the client. That's not my sole focus. I'm also interested in bringing myself in and introducing myself as a significant ingredient in the relationship. So I talk about what I feel, what my experience is with the person, or perhaps the things I've experienced in my life as they're relevant to that client's experience. So by doing this, we build up a dialogue, we build up a relationship. So the emphasis in Gestalt is very much on that relationship and on the experience of contact that both the client and I have. So there's less emphasis on simply diving into the client's world, although, of course, that's important. And I'm frequently checking, what are you feeling? What are you experiencing? How does this impact you? However, it's important to understand that empathy in therapy, as I said, is often like a skill. I'm using a skill to understand the client's world. In Gestalt, we're less interested in the use of skills, although, of course, we do use a range of therapeutic skills, from interviewing and questioning skills to exploring experience skills. However, what makes Gestalt different is that we're interested in the person's beingness, you could say, in really who they are, and who they are as how they experience themselves and how I experience them. So this is a different kind of focus. Gestalt is also in the class of existential psychotherapies. So that's what this is related to, exploring what is in both people's worlds. And so it's not so much a matter of techniques, it's a willingness of myself to be present with the client, to dive into the experience, into their experience, yes, and reflect that empathically. Also dive into my experience and bring that into the mix as it supports contact. And a lot of the goal of Gestalt, you could say, is to highlight awareness. What is it that you're doing? Who are you in this place? How do you meet the world? These are the basic questions which are answered through the medium of exploring relationship. So to do relationship is less of a technique and more a requirement of the therapist, me, to bring myself in fully, to invest myself, to not just hold back and either objectively assess the client or simply give them empathy as a kind third entity. It's about me being willing to make myself transparent so that the client can see me. And it's not begging the client to understand me. It's using my own experience in the service of building relationship. So when I'm doing Gestalt training, when I'm teaching people how to do Gestalt, I'll never use that word empathy because I don't want to encourage people to think in the terms of skills so much. And I also don't want them just to focus on the client. It's a bit too easy and convenient to do that. Of course, they need to be able to reflect back the client's experience. That's certainly true. And that is developed through experience and practice. I don't think it's the main thing though. It's only one element. And I would rather that the therapists understand more about themselves and are able to bring that in than simply practice the skill of empathy, which is about, let me investigate your experience over there in your world. That's one important ingredient. There's a lot more to it. So that's how I would talk about the way that I use empathy. And the last thing I'll say is that different clients need different things. Some clients are more, let's say, fragile and need a greater sense of safety. And for some people, that safety comes firstly by me really understanding their world. And in that case, yes, more use of empathy is appropriate because they don't have much capacity to take in or even develop their own awareness. They need a supportive scaffold for that. So for some clients who are like that, then yes, I will use more empathy. That's not my preference, that's not my tendency, and I'm certainly not going to do it across the board. What's really important from a Gestalt point of view is what each person needs. Well, that's a good question. It's an important question, and the topic of ethics and psychotherapy is a very large and complex one. So I'm not going to be able to address it just in one sitting. I guess the first thing I think of is, why do we pay attention to ethics? Why is it important, apart from, philosophical reasons and social reasons and professional reasons? But really, why is it important? Because I would say, fundamentally, I don't want to hurt the client. That's the first thing. My intention is not to harm the client. My intention is to benefit the client. So I think that's the first principle, and that's the basis on which I make decisions. Okay, so that's the simplest version. And I think, most therapists would adhere to that, would want to follow that. So that guides us in a general sense. The second thing I'll say is, why do we have ethics? Well, apart from determining that it's important to help people and not harm them, which is a little too general to be that useful, the question is the specifics. What is harmful in therapy and what is helpful? And here's where different models of therapy have different ideas. So for instance, classical psychoanalytic therapy would say it's harmful for the client to know much about me as the therapist. They hide pictures on their walls. They don't want anything identifying them because they would see that as unethical, as being somehow harmful to the client, because the very therapy operates on kind of not knowing anything about me. That's, classical psychoanalytic therapy. So each therapy, according to its model, has ideas about what's harmful or what's helpful. Some of those ideas overlap and some of them are different. So for instance, you take somatic psychotherapy, soma, body, psychotherapy which works with mind and body. So in somatic psychotherapy, we're not just working with the mind or the emotions, we're working with the whole body experience, moving the body, feeling the body, touching the body. And so from a somatic psychotherapy viewpoint, that's a good thing. And that's helpful to people. And so in that context, well, what kind of touching is helpful and what kind of touching might be harmful? So that's the kind of route that I'm going to come from, because Gestalt, I think, is very much somatic psychotherapy. It's definitely not just a talking therapy. It's an action therapy. We participate in experiments, we do things, we try things out, we get up from the chair, we yell or laugh, or, we try out what we're talking about. So it's not just in the head, it's not just theory. And a part of the Gestalt experiment uses the body in some way generally, moving the body, and includes touching the body. So within a Gestalt frame, firstly, touching the body is fine, as long as it benefits the client, as long as it's in service of the therapy. So intentionality is one very important factor in looking at body touch. Within that, if we drill down, well, how do we know what kind of touch is helpful to the client and what isn't? One of the principles of psychotherapy, and certainly of Gestalt, is informed consent. That is, I let the client know what I'm intending, what I'm thinking of doing, and I get their permission. So in Gestalt, when we do experiments and when we move towards touch, there's a lot of getting permission. This is what I'm thinking of. This is what I suggest. Is that okay with you? So that's one important ingredient, that it's all by consent. The person always has a choice. Now, of course, the client's in a lesser position of power, and sometimes they don't always voice their discomfort. So that's also our responsibility as therapists, as I understand it, to look and see if the person's yes is coherent with their body language, with their mood, with what we know of them. So I also need to be knowing the client and tuned into them and sensitive to them. So I both listen to what they're saying about body touch in this case, and I'm also feeling it out literally. If someone pulls back or they tense up, then that's probably an indication that something's not comfortable for them. So there's lots of feedback mechanisms there. If we're talking about body touch, I'd use the analogy of massage. I mean, when someone goes for a massage, they go to be touched. And so, that's legitimate. And again, there is the question of what kind of touch is ethical, is good for them, and what kind of touch is bad for them. And so a massage therapist also has to deal with these questions. But I don't think touch is inherently unethical. I mean, that would be kind of very anti-human. Touch is an inherent part of who we are as human beings. And I think that in some ways you could almost be said to be unethical not to use touch in psychotherapy where it's appropriate, because then we would be avoiding something profoundly human, possibly needed because of some idea that we have or some theoretical model. So I'm really not interested in theoretical models so much. I'm more interested in who the person is, what helps them, and specifically, if I'm going to use touch, what kind of touch is going to be helpful for them. Now, there's a very clear bottom line. Sexual touch is not helpful. Sexual touch is beyond the boundary. I'm not going to participate in any kind of sexual touch, sexualized touch, sexy touch, nothing like that. And if I detect touch, physical contact, becoming sexual in some sense, then I'm going to say something about it. I'm going to, pull back from it or remark on it, because I don't want to do that. I don't consider that that is a helpful kind of touch. So that's a very clear bottom line for me, and I would say probably for any therapist, including massage therapists who are ethical. So we're not going to do sexual touch. Okay, that's simple. Then there's everything else. Well, then how do we make the touch ethical? One thing is consent, another thing is tuning in, another thing is knowing the client, another thing is my intention. And then there's just the question of, how does this help the person? So there's lots of different ways to use touch. You can use touch to bring awareness, for instance, just to body parts which are stiff and the person's not even aware of that. Or sometimes the person does have awareness and touch is like support, and that can be very big. And, it doesn't have to be big touch. It can just be very present, very still touch. It doesn't have to be moving. It's not like a massage touch usually. Sometimes it's just touch for awareness and holding it still in that spot. Sometimes you use touch to intensify someone's awareness. So, they've got a pain in their back, and so if I touch there, I bring more awareness to that pain, as well as bringing support. So touch has lots and lots of layers to it, and I could spend a lot of time talking about it. I just want to answer the question basically. So fundamentally, no, I don't see it as dangerous. I do see it has a place in psychotherapy, certainly in Gestalt, because in this modality, we work with bodies as well as minds. Gestalt is a holistic modality. So we don't want to just work with the mind, we want to work with the body-mind, because that is all of us. And the soul perhaps too, if you want to say that. But concretely, practically, body-mind is what we're working with. So touch, I could also say that touch enhances relationship, it enhances connection, and I see that as a positive thing because I'm interested in what contributes to the relationship. Some people are afraid, some therapists are afraid that if they touch the client might get sexually aroused. And I'm not afraid of that, because if that does happen, then I'll just deal with it. But, it would be like going through life and saying, well, I'm never going to touch anybody because they might get sexually aroused. I mean, we touch our children, we hug our children or our friends. Touch is not all about sex. And so I think some of the fear is a kind of a sexualization of touch. So that means that I need to be comfortable with touch, of course. It's very much about me and about my capacity to be present, to be aware, to notice what's going on with me, to notice what's going on with the client, and to use touch therapeutically. That's the bottom line. What is it that helps the therapy? What is it, in Gestalt terms, that helps awareness? What helps contact? These are the guidelines in Gestalt for deciding what's ethical about touch. In fact, we could say what supports the therapy, what supports the person's development. Gestalt is not formulaic. There's not like one size fits all, or in this situation, this is what you do. That's a formula. Gestalt doesn't operate by formulas. That makes it hard to teach and hard to practice, because you've got to be in the moment. And I've got to be with myself and the client in this moment and not be too heavily dependent on theories or ideas. So the question is, how much touch? I can't answer that. I can only say, in this moment, with this client, what seems right to me? I propose to the client. Do they accept it? Let's do it and see what happens. And sometimes it's too much. Sometimes I'll say to the client, right now in this circumstance, if I imagine myself in your position, I might like a hug. But I don't know about you. What fits for you? And some clients will say, no, don't like hugs. That's fine. I'm not going to go there. Other clients say, yeah, that would be really nice. I'd really appreciate that. So, I'm doing a lot of the advancing and checking out. It's very rare a client will ask for that. They don't know the rules of psychotherapy, or they don't know what's okay, or maybe they're not used to getting touch in their life, so I'm introducing something which might be new and exciting but risky for them, they didn't know they wanted it or it would help until we do it. That's the nature of Gestalt experiment, introducing novelty, a new experience. What happens if we do this? So I can't really answer the degree of body contact other than saying it depends on the circumstance and on the client. Remember, the bottom line is what's good for the client. I mean, that's what ethics is about. It's not about ethical theories or professional standards. It's what helps this client. And you always need to keep that in mind. The therapy is the therapy of the client and of the situation. Type of client is not suitable for body contact. Clients who don't want it, clients who perhaps are very fragile and very sensitive, and a little bit of contact might be too much or overwhelming, in which case proximity is enough, physical proximity. And again, I'll check how close is the right amount. Maybe it's sitting on, 3 meters away. That's right for them. Maybe it's 1 meter away. We can experiment with this. I can move closer or distant. The client can move closer or distant. So it depends on the sensitivity. Obviously, it depends on their history of touch. If people have been hit or been sexually abused, then touch has all sorts of meanings. And, I have to navigate very clearly what does it mean, and what are their limits, and what do they yearn for, and what's the point of overwhelm. So I'm constantly looking out for that. That's why it's not good to have theories in your head. You need to really focus on this client in this instance, in this moment, and what's happening. And it might change to the next moment. That's why I really don't want to give formulas other than be present, be aware of myself and the client. It's a little difficult for me to answer because I'm not a female. So that experience of you as a woman is going to be unique. Again, I don't think there's a formula. What's comfortable for you? How comfortable are you in your body? How comfortable are you with someone else's body? How comfortable are you with attraction, for instance? Because sometimes touch will bring closeness, and with that comes attraction. And so, even without sexual energy, there can be attraction and warmth. So it's an important question as to how much I can stay grounded when there's attraction or warmth or something, not leap over the boundary, not lean forward, but just stay present, notice, bring it into my awareness, maybe into the client's awareness. So all those questions are for men or women. For women, of course, there's an additional question of safety, of what you feel safe with, within yourself, with this client, with touch in general. So, this requires you to do your own psychotherapy around touch. And obviously, part of that is, it's obvious to me that would be with a therapist who works somatically, not just talking about touch. Some of that's useful. So you need to know about yourself, and if you've been sexually abused or something, or you've been hit, then you have your own associations with touch and your own tensions or, pain. So all that needs to be addressed, I would say, in psychotherapy for you to be able to stay present, stay aware, stay in yourself with a client. And especially, let's say, with a male client. So, whether you might be a bit scared of them or a bit attracted to them, whatever that is, you need to be able to stay present in yourself. And the more that you can stay with yourself and have clear boundaries and yet be able to make contact, which is the essence of Gestalt, the more that you can come into contact. If you're avoiding contact, including physical contact, because of that fear, then I would say that's not in the interest of the client. And, some people use ethics as a kind of an excuse for not really meeting the client. Keeping safe as a therapist, yes, but not being willing to come up to the contact boundary. So I'm giving a kind of a general answer to that question. It depends on each unique mix of client and therapist, who you are, who they are, what's right for you and what's right for them. It's got to be right for both, of course, in terms of being able to have that quality of contact. Well, that's a very big question. And in a way, it takes some training in Gestalt in a way to be able to answer that question well and to understand it, because there's so many things we're doing in a Gestalt session, and I can only give you the headlines to name them. I don't have the space here to go into each of those in details. So no, we're not looking at diagnostic categories in Gestalt, not interested in that, whether it be, DSM diagnosis or even Enneagram per se. These are all labels that are being put on people, sometimes useful, sometimes descriptive. I'm not saying that they don't have their place or their value. Fundamentally, though, that's not what I'm looking at. I'm not looking to diagnose the person. I'm looking at who is this person, and that's a very big question. And I understand who is this person by how they understand themselves, how they feel themselves, their history, their context, their field, as we would say in Gestalt, my experience in relation to them. These are more the things I'm looking at. We say I'm investigating their world of subjective experience. So I'm not interested in objective measures like these kind of labels do. I'm interested in the uniqueness of this person, which means that I can't really label them, because a label is saying, well, this is similar to that. But even two people with borderline personality disorder are not the same. Each of them does it in a unique way. Two people do depression in a unique way, although we can see common factors. So in Gestalt, we're not so much interested in the average and the common factors. We're interested in the uniqueness of each person's experience. So someone comes to me with depression, I say, how do you experience depression? In fact, how do you experience day to day? Because that's probably going to change. So the things to look for in a Gestalt session are how it is that I explore someone's experience. How do I understand their experience, not just cognitively, but by really stepping in and, as we say, coming into contact. So the things to look for are how do I make contact with the person, and how, we could say, do they avoid contact? Because we're also paying attention to that. All of us avoid contact, we avoid awareness, and as much as we long for connection, we also draw back from it. So when you're watching me work, you can be interested. How do I move towards contact? How does the client move towards contact? How do we meet? How do we miss each other? What happens in the missing? Am I coming too far forward? Am I not stepping close enough? Is the client holding back? Are they rushing in? These are all what we would call process observations. Don't look for the content, what we're talking about. Look for how it is we meet. How does the client meet? How do I deal with them? What's the tone of voice you can hear? What's the movements in the body? These are some of the things I think to pay attention to. You can also pay attention to where is it that I follow a particular direction. I'm trying to cue in terms of the client's arrows, and where do I follow an arrow? So sometimes there's an arrow to the field, to their context, to their family. Sometimes I'm interested in that. Sometimes they bring something forward. You can look for, what's going on there? What is that arrow that points in that direction? You can look for how it is that I work with awareness, to enhance awareness, to focus awareness, to allow awareness to flow. You can look for where is it that I attend to the blocks in awareness, and how do I support the person in that place? You can look for how do I deal with the person's resistance, usually not by pushing it. Sometimes I make that mistake, but for the most part I do my best not to push it, but to respect the resistance, to be with it. So you can notice how I dance with resistance. You can look for where and how I step into experiment, trying something, moving from talking about something to doing it. Let's do this. This is what I suggest. Move into action. Try something new. Notice what the experience is. So you can see how I design experiments based on what the client's experience is, how I construct those experiments, and how I evolve those experiments. I don't just push them, I suggest them, I see how it works, maybe I change tack. You can look at my flexibility in that. And certainly you can look at the whole relational dimension. How do I make contact with that person? How do I build relationship? How do I talk about my experience? How do I bring myself in? These are all the things that I'd invite you to look at and be interested in the Gestalt process. You can also look at the whole session and look at how it's like a wave, how we look around, we find something to focus on that we're both interested in, what we would call the figure in Gestalt, how that develops into energy and expression, contact, and resolution, generally by the end of the session. So you can also be interested in that. Lots of stuff to pay attention to. Those are some of the things that I'm paying attention to, that I'm working with, and that you can also be interested in a Gestalt session.